Session is now reconvened. I believe we were on the question of Senator Shelton, but I believe the speaker has a point of information that she would like to present. Speaker, you are recognized.
Madam Speaker, and just for the record, I just want to note to our colleagues in this august body that an updated revision of the fiscal note was sent down by BBMR. So I just want to note for the record that all our colleagues have a copy of this new document that was presented to us this morning.
Thank you, Madam Speaker. Senator Shelton, you are recognized.
Assiduous Masi, Madam Speaker. Good morning. I'd like to thank BBMR for the quick turnaround time in trying to provide us the information on the cost to the government of Guam. And BBMR again says in the new fiscal note, per correspondence with DOA, although the government of Guam health insurance negotiations for FY 2020 have already commenced, DOA is prevented from releasing data on costs and the potential effect of the proposed legislative changes included in this bill by the need to maintain confidentiality during the negotiation process, as well as HIPAA concerns, and continues to say, as such, the Bureau is not able to determine the potential cost to the government of Guam at this time for FY 2020. I do want to thank them for trying to provide us the information from FY 2018 and 2019 and the percentage of growth during that period of being 0.83%. However, I think this still doesn't answer the question. It's important for us to know the cost that it will be to the government of Guam. It'll affect our budget, what we do moving forward here in the legislature. It'll affect our taxpayers. Most especially, it'll affect the 12,532 government of Guam employees and retirees who will be paying their share of this insurance. And Take Care and GRMC have both been putting out numbers of how much this will cost our government employees, and the estimate that Take Care puts out says that employee share for a family can raise by 400%. That's a real concern, but that's a number that Take Care is putting out. And there are lots of other numbers floating around, but I think that what we need to hear in this body before we move forward is an impartial analysis from BBMR. So I'd like to hear from my colleagues on this issue. Thank you. Assiduous Masi.
Assiduous Masi, Senator Shelton. Any other senators would like to speak on the bill? Any other senators would like to speak on Bill 30? Senator Terlahi, you are recognized.
Thank you very much, and welcome back, Madam Speaker. Good morning to my colleagues. Government of Guam health insurance is the largest procurement by the government of Guam in a year, annually. It's estimated to be approximately $91 million. It is also one of the most complex solicitations and negotiating schemes in government procurement. Health insurance industry is a complex industry. Experts make a living, consulting state governments and our own local government in this field. And I know that the negotiating team hires consultants every year to advise them, and states hire consultants to advise them as to the impacts of different health policies. We are being really, I wouldn't say we're drowning, but we are definitely being bombarded with arguments all around for and against this bill. Even doctors seem to be divided on the issue. The debate, of course, it has highlighted many issues that must be solved, problems that exist in our current negotiation or contracts, problems in billings, problems in collections, all kinds of problems that the government of Guam must do better on. and I believe that we can solve those, but they're not solved in this bill. We cannot solve those, however, I believe, with less competition in our procurement, and we cannot solve our problems with unequal bargaining power in negotiations. We know for a fact that federal law requires in emergency situations that the emergency medical treatment and labor account explicitly forbids the denial of services to any patient in an emergency situation, and thus GRMC must provide care to patients in an emergency situation regardless of whether the patient's health insurer has an agreement with GRMC or GRMC is part of its contracted network. Also, we know that the current and previous GovGuam health insurance contract includes a provision that states if a carrier does not contract with the provider of any sole source service in Guam, it must reimburse the sole source provider by such Guam provider as if the sole source provider were a participating provider. So there is a lot of debate in the community about coverage at GRMC and access to it in emergencies, access to it under those circumstances. And I think that wisely the negotiating team has ensured that there is access. The bill we are looking at today is very similar, if not identical, to the mandate that was proposed in the last term by the former Speaker Cruz. That bill received considerable opposition from health insurance providers by the Department of Administration, and it was withdrawn. The bill we're looking at today is a result of another law that passed in the 34th Guam Legislature, which required that the health insurance negotiating team forward only the lowest cost option of either the exclusive or non-exclusive proposal to the governor. That was a huge change in our policy for negotiating health insurance. That law was intended to save approximately $18 to $20 million. It was passed in the midst of a fiscal crisis, maybe several of them that we were facing, and the legislature was making very hard choices at the time to save money. We were cutting, we were foregoing the renovation of a maternity and the labor and delivery ward, rather, at the hospital, and many other things in our government. I attended the public hearing for this bill and was also in attendance at the public hearing on the bill in the last term. And there were many concerns presented from health insurance providers, and some of those remain regarding higher costs for the government and its employees and retirees, a reduction in choice because of the higher costs, and potential legal challenges that may delay or cause another bar to the negotiating and selection process, which is exactly what happened when the negotiating team last year put a very similar requirement as in this bill. They put that in their RFP, and it was contested. And so that was never really resolved because they settled, and I guess the settlement was to carry over with the prior contract. So that's what we are operating for fiscal year 2019. By mandating all health insurance providers to include the private hospital in their network, it creates a potential competitive advantage for that private hospital to negotiate whatever fees it may choose, potentially tying the hands of GovGuam and its employees and retirees. The private hospital may be empowered to set their fees at whatever level they choose, and as a private entity, they are not bound to the same requirements that GMH has in monitoring its fees through public hearings and transparency. The fiscal note from BBMR in February. Now, we've received two since then, but in February and also last year, the fiscal note, and last year's fiscal note, where they both said that, and I quote, "There is a potential for cost escalation due to reduced competition, and, quote, a potential for the overall pricing basis proffered by the qualified insurance providers to increase. It did not give an exact amount of the potential increase due to a lack of data, and now they're saying they can't do that because of the confidentiality of the information. However, there are estimates, and we've all seen these, by Take Care, which estimate an additional $20 million to the total premium for Gov Guam, and that some policy premiums for families would increase by $120 per month for employees and $140 per month for retirees. Currently, about 16% of Gov Guam employees and retirees choose a health insurance plan that does not include the private hospital, and we wonder why. And we're speculating, and I'm guessing that it's because they are choosing, they feel they cannot afford the premiums to go any other way. We know at the very least that this 16% will see increased rates, and it's unclear if other insurance companies' current negotiated rates will be affected if there's a lack of competition or no incentive to negotiate lower rates. I'm wondering if we should speculate as to the impact to the government of Guam. We are not given, any independent analysis, as my colleague pointed out earlier, and whether this bill would wash away that $18 to $20 million in savings that we were trying to obtain by passing the bill in the last term of the legislature, which is really, I think, the crux of the issue here. In that bill, we tried to save money by forcing, perhaps, an exclusive contract with only one provider. And now we are trying to undo that by forcing mandates with who we're going to contract with, those provider, or that health insurance company would contract with. Perhaps I think it's better for us to reconsider that choice, if that is really what, if we have this extra money, then I would much rather go back and reconsider that choice and allow the government employees to have a choice of health insurance companies again, and I would think that would be a better use of a potential $18 to $20 million, rather than, end up with an exclusive one insurance company. We don't even know at this point the impacts of other insurance companies, being left out, and how that will impact the rest of the community in other ways. And we don't know the impacts on the government of Guam as to, amounts. And there are just too many unknowns. If we want our employees and retirees to avail of Gov Guam health insurance, we have to do all in our power to hold down the costs. And some suggestions have been made to allow the negotiating of prices before mandating any provider. There have been allegations that this bill will also negatively impact GMH. It's my understanding and my hope and expectation that the government's fiscal team is scrambling to find money for the $13 million in Medicaid that we are going to need beginning April 1, and the critical GMH CMS improvements that we have been discussing for years, and the new maternity ward that we had to forego. And that they have not given their input as to whether funding this private hospital benefit for Gov Guam employees should be prioritized over all of those other projects. Or if the Guam Memorial Hospital is at this point foregoing its desire, which they expressed to the legislature, to rise to the challenge and to provide services that it currently does not provide to the people of Guam. And of course, they're going to need our assistance to do this. I believe it is imperative that we as policymakers with the power of the purse strings take the time necessary to be fully briefed about the fiscal impacts before we act. There's been much testimony, even testimony that we received after the public hearing. After the public hearing, I think almost every day we've received different testimony from different members of the community. And a few of these are Select Care. They stated that the bill would be better if amended to, quote, ensure that the requirement to include all private hospitals is fully vested and left in the hands of the negotiating committee. They also mentioned that they are, quote, concerned with what would potentially become negotiating advantages for the new private hospital and the consequences of potentially higher fees. They recommended implementing safety nets and limits to cost increases. But none of these recommended amendments is included at this time in the bill. Take Care's testimony, of course, and their concerns were very similar to what they had testified years ago, that this bill would cause rates to rise exponentially. They outlined equal protection rights, violation of due process rights of health insurers, improper delegation of power, and negative impacts to revenues at GMH. The Guam Federation of Teachers opposed the bill. They cited potential cost increases to employees and retirees. Dr. Thomas Shea has registered his opposition to the bill, and his testimony suggests that if we are going to do this for a private hospital, why are we not going to do this for private providers, such as him, who has, I'm paraphrasing here, but who has services available at his clinic that are not anywhere else in Guam. And I thought that example was very interesting. We also have Government of Guam employees who have expressed their concerns with being unable to afford any increase in premiums. There are community members who've registered their support for this bill, and some of them have suggested that we put a cap on the GRMC fees if we are going to mandate that GRMC be included. Unfortunately, that cap is also not part of this bill. I understand and commend the intent of this bill to ensure that GovGuam employees and retirees can access the private hospital in Guam. However, I'm concerned that the cost to the government and GovGuam employees and retirees may be, they're unknown at this point. They may be too high, and if so, would preclude these same employees and retirees from seeking the services altogether, or preclude GMH from expanding its services. I know that time is of the essence if the legislature is to dictate the terms of the new solicitation for health insurance by the GovGuam Negotiating Committee. Yet, I can't help but feel that if all the insurance companies and some physicians are warning us of significant increase in costs and change in negotiating power unless we do more, that we should go back to the public hearing process and work some more to come up with the language that will avoid increasing premiums or deductibles for the employees and retirees of the government of Guam. I believe we can do better if we do not buckle to pressure to act uninformed or to embed the government in a legal battle and forego, a new contract. And that we don't need to forego other solutions, such as allowing the negotiating team to negotiate rates with the private hospital. Those are just some of the suggestions that were made. For these reasons, Madam Speaker, I would move that I would move the bill back to the committee so that we can consider the caps that have been suggested on the GRMC rates, or we can consider who should negotiate rates if we are going to mandate that this private hospital be included in the contract. Or consider the rest of the testimony, and most of all, consider the impact, the financial impact on the government of Guam, which I feel is not available to us today. That would be my motion, Madam Speaker.
Thank you, Senator Talahi. There has been a motion to move Bill 30-35 back to the committee. I hear there is an objection. So, all those in favor of moving Bill 30-35 back to committee, please raise your hand. Motion fails. Any other senator would like to speak? Forgive me, Senator Chalahi, you're recognized.
I was going to proffer an amendment, Madam Speaker, but I don't think it's been fully prepared yet. So if I could ask the indulgence of the body to proffer that at a later time, I would appreciate it. Thank you very much.
Thank you, Senator Chalahi. Any other senator would like to speak on Bill 30-35? Senator Pito Terlahi, you're recognized.
Si Zeus Masi, Madam Chair, kula na sasahu ni pabaya kung si Sabrina, si Therese needs on the testimony. But for one, let me just say that Bill 3035 is a good bill. We cannot avoid any other healthcare services with the limited hospitals that we have, so we need to allow GRMC to be part of that. Zangitaatan nay. Zangitaatan ni numero gi hafa po magasta. I'm not worried about the $1 million that we are going to incur if the suggestion is to move back Bill 3035. What I'm asking is that, if we make the comparison on the cost for in-network average for patient costs, an average outward of network patient costs, if you look at these numbers, the specialty clinic visit for one in network is $40. When you go out of network patient costs, it's going to cost $1,413. And we go down to emergency room visit on in-network costs, it's $195. And if we go out of network, the patient cost would be $1,948. So, may latataatan ni diferensya gini. Outpatient visit for in-network costs, $143. Out-of-network costs for patients, $1,431. More than what? More than, I would say, 80% of that money that is being forked out on the out-of-network patient costs. On the inpatient staying costs, in-network patient costs, it's going to cost $1,500. Now, if you go out of network costs for patient costs, it's going to cost $34,175. So this is what my argument is. Forget about the $1 million that we anticipate to incur if we go to one side or the other side, right? We need to realize the cost of the patients. The inpatient stay, the inpatient visit, the inpatient room visit, the outpatient visit. These are the things that would really hurt patients going out to the out-network patient costs. So this is just my argument. I am not against, moving back Bill 30 to 35. I'm not against that. But we need to realize that, the thing is, we need to understand the cost of patients right now, because that's the biggest part of the problem that we have. Because we don't have rich people on this island. Maybe, people that have big businesses can afford the out of network costs. So that's my argument. I am not against, what Senator Teresa Lai just mentioned. But I just want to put this out that this is what I've gathered that would benefit our patients on island. Thank you, Madam Speaker.
Thank you, Senator Pito. Is there any other senator that would like to speak on Bill 30? Senator Torres, you are recognized.
Thank you, Madam Speaker. One of the retiring speakers spoke about the nature of this bill, and there appears to be no win-win situation when you look at the different sides that are arguing their points for and against this measure. And there's no doubt that it has a business impact on the only carrier that does not offer in-network coverage of the one private hospital versus the others, or the hospital that now has to see patients. What I want to point out is, while the Emergency Medical Treatment and Active Labor Act, EMTALA, does in fact apply and requires that any member, any citizen of Guam who's taken to the private hospital for emergency care must be treated, and that our contract also calls that any patient, and I'll quote here from the agreement, if a carrier does not contract with a provider of any sole source service in Guam, it must reimburse for the sole source provider if the provider are participating. I'm sorry, I've lost my place. Let me take that back. GRMC must provide care to patients in an emergency situation regardless of whether the patient's health insurer has an agreement with GRMC or GRMC is part of its contracted network. Madam Speaker, my point that I'm trying to make is we understand that EMTALA requires that the patients receive emergency care at our private hospital. We also understand by the contract that GRMC can provide and will be reimbursed for services if the services are not provided at or available at the public hospital. But what we're not discussing here, and I want to advocate not for any one party, I want to advocate for the employees, the Government of Guam employees who are currently with an insurance policy that does not have in-network coverage at GRMC. Madam Speaker, the devil is always in the detail. And while the contract provides that you can get reimbursed or you will be reimbursed, the method by which a GovGuam employee seeks reimbursement is not practical. Is not practical to the point where of the 1,600 employees that have sought care at GRMC who are currently Take Care members, these employees had billed at a full price. That's just the way it is. They have to be, because they're out of network. As a result of the 1,600 employees with this one insurance policy that is not in the network, they personally have to pay GRMC to date $13.5 million out of their personal pockets. So while we're talking about, can we afford, what is this going to cost us? Everything has to be taken within context. It has to be taken into account. The bigger picture has to be taken into account, Madam Speaker, because what we're looking at is 16% of GovGuam employees currently are subscribing to a plan that doesn't include GRMC in their in-network coverage. The exposure to those employees is great. The devil is in the detail, Madam Speaker, insofar as if I were to, and I am one of those employees under that coverage, so I can speak from my personal perspective. But this is fact. I will be required to pay my bill in full. And then I must provide, before I can even make a claim, and then I must provide a certain number of documents, original receipts, the records, all of that, and then make the claim for reimbursement. The reimbursement is subject to the eligible costs, which are determined by my insurance company. So while reimbursement is factored in, it is not 100%. And as a result, we see that so many of these patients, 1,600 of them, have amassed a bill that large. So when we're talking about cost, let's just factor in the cost to the individual. Let's take the business side of it out for argument's sake. Because what I want to appeal to and what I'm advocating to on behalf of the employee is we're really looking at the dignity of health care on Guam. In years past, we didn't have the luxury of getting full medical treatment for any variety of illnesses, particularly those that affect Guam citizens, diabetes, cardiac issues. We now have a facility that can take care of those. In the past, when we didn't have full care, including cancer care to some degree, we were forced to either not get care or go off island. How horrible is that? When one of our top priorities of this government is health care, to force our people to have to go off island. Now we're in a situation where we have facilities that can provide, and by default, many of us will end up, whether we have coverage at GRMC, will end up there because our hospital can't provide certain services, and where they can't provide certain services, we will be referred over to GRMC. The rate, I believe, can be contained insofar as the rate escalation, if we factor in what the escalation was when GRMC entered the market, that rate, we know that it went up by 13%, but annually after that, the rate increased by a nominal amount, averaging about 2.6% annually. So if you're worried about what the entrance of an additional carrier with 16% of the market share is going to do, it's not going to soar, I don't believe, exponentially. And if we're worried about runaway rates because we don't have a commission right now that can regulate rates when there are fee increases, or their private hospitals not subject to public hearings on rate increases like our public hospital is, then maybe we can proffer a simple amendment to this, where we can have an amendment to negotiate it at rates not to exceed those adopted by Medicare. Medicare rates, there's a science to Medicare rates. And maybe that is the cap that we're seeking to alleviate our concern about skyrocketing rate adjustments down the road. But Madam Speaker, going back to my original point about the payer, I'm just so concerned about the availability and the provision of health care on this island and access to health care by our GovGuam employees. There are about 28,000 GovGuam subscribers right now. If we follow the letter of prior law, which says that the negotiating team shall award to the lowest bidder, let's assume that the lowest bidder can underprice their competitors because they opt out of this in-network provision. That could potentially subject all of us to having coverage if GovGuam were to go with the lowest bidder who doesn't have in-network provisions with our private hospital. It could subject all of us to the scenario where 1,600 of us have already found ourselves. We end up in the emergency room, and most people get admitted as a result of being taken to the emergency room. They get admitted for specialty care. They amass a bill that is full price, not negotiated, discounted prices, full price. In order for them to get reimbursed per the agreement with the thing, they must pay their bill in full. The average inpatient bill estimate would be at the top rate, $34,000. So you and I, Madam Speaker, will pay our $34,000 bill on the spot. Gather up all the pertinent information that's required, documentation, submit for reimbursement, and then pray that the eligibility comes close to that, assuming we have an 80-20 plan, whatever plan we have. You see, that is what I'm talking about, and I believe the retiring speaker spoke about that as well. We understand the business model. Everybody's going to argue for their bottom line, and I don't necessarily want to hurt anybody's bottom line. But what I want to talk about and remind us is we're talking about GovGuam employees. We're talking about you and I and the very sick people that, whether by choice or not, that ambulance is going to take them to the nearest hospital, or our public hospital is going to refer them over for specialty care that the public hospital cannot provide. And we are stuck. Why must we be stuck when we have the ability right now to provide basic standard care and be true to our mandate to provide adequate health care on Guam? I want to go back to the dignity of it. I find it so undignifying to believe that I will either wallow in a place that can't take care of me or lose all of my assets or my family's assets because I just want adequate care and I don't want to go off island to some foreign country. You see, that's what we're talking about. It's a basic standard, and I don't know about you, Madam Speaker, but I remember when that hospital was opened. I remember thinking, oh, look at what we finally have on Guam. Somebody invested in something. Now we have the dignity of receiving appropriate care. We have one of the highest rates of non-communicable disease on Guam. Madam Speaker, we know the effects and what it means to the average person with GovGuam insurance when they don't have in-network provisions. We know that they are very likely to end up there anyways. And if not by choice, if they choose to go somewhere else, oftentimes they will elect to be discharged against medical advice, which puts them in another predicament in terms of eligibility for reimbursement. So I'm speaking to the very dignity. I should hope that if I should become very ill, that I have the ability to not only receive health care on island at a facility that is here that can provide it for me, but that we would have negotiated something reasonable so that we don't subject our people to having to pay full price, in full, out of pocket, and pray that they get reimbursed a sufficient amount. So I would like to proffer an amendment, Madam Speaker, if I may, to include at the bottom of the, to line 4 to 8 on page 1 of the bill. I'm sorry, at the end of line 8, to add the words, at rates not to exceed those adopted by Medicare. And I believe
Senator Torres, can you please repeat your amendment?
the amendment is to add the lines, the words at the end of the sentence on line 8, at rates not to exceed those adopted by Medicare.
Does everyone have a copy of the proposed amendment by Senator Torres?
I have not made a copy, Madam Speaker, but I may.
We'll take a quick recess, quick 1-minute recess for everyone to get a copy of the proposed amendment. Thank you.
Madam Speaker, actually, I'll withdraw my amendment. I'll withdraw my amendment.
Okay, we are now returning from recess. Senator Torres would like to withdraw her amendment. Thank you, Senator. Any other senator would like to speak on Bill 30? Senator Lee and then Senator Marsh. Senator Lee, you are recognized.
Suzus Masi, Madam Speaker, and good morning, colleagues. You know, I've had the privilege of listening to many of you give your thoughts and I've actually had the good fortune to hear from many of the members of our community with regard to this bill. We received emails from people, phone calls. We've been listening to folks on the radio kind of just give us their perspective. And in that time, I've really started to think about the idea behind insurance. Why do we have insurance? What is it, and why is it so essential? Insurance, Madam Speaker, is a safety net. It is there, and the basic premise of having insurance is that it helps to protect policyholders from unforeseen circumstances. It helps to protect individuals from things that we just can't see coming. And so that's why, many places, Guam included, you have to have insurance if you're gonna be out on the road, because we want all of the people, all of our drivers and our passengers to be protected. We want to protect the public. We want to protect them from potential catastrophic events that happen in our lives. And I think that the whole reasoning behind insurance is it's supposed to work for the policyholder. It's supposed to work for us and not against us. And I think that in the instance of, as the previous speaker was mentioning, over 1,600 policyholders that have been treated at the private hospital, they are considered out of network. 1,600 patients who have been treated for, sometimes life-threatening illnesses or accidents. And I really also got a chance to think about where our people reside. When catastrophic events happen, where are they on our island? And in terms of EMTALA and all of the different things that are in place, if somebody from Dededo or Jigo or somebody who just happens to be up there has a stroke or, God forbid, has a heart attack, under the current situation, they are stranded in terms of their geography. More than half of our population lives in the north of our island. To include, when I'm thinking about this, I'm thinking of my grandmother's sisters who all live up there. Some of them are, GovGuam retirees that have coverage as GovGuam retirees. And I just feel that it's extremely unfair to leave a large part of our population stranded because of where they live. And I feel like all of our employees, all of the employees of the government of Guam, all the retirees, and our foster children especially, deserve access to the widest health care possible. And when you look at this, folks that are covered under the 3 M's, Medicare, Medicaid, and MIP, they have essentially more access than some of these GovGuam retirees and employees do. And so I also got to thinking, Madam Speaker, what if we do nothing? What if this bill fails to pass, or what if we just, send it back to committee and have it die there? What is the cost of us doing nothing today? Another what if scenario. If we do nothing and Take Care ends up winning the bid and not including in-network coverage at our private hospital, there is a potential for 84% of the GovGuam base going from having a choice to having no choice. And what really struck me, Madam Speaker, is it also places a tremendous burden on an already struggling Guam Memorial Hospital. I have been a patient at Guam Memorial Hospital. The doctors and nurses at Guam Memorial Hospital have saved my life on at least 2 occasions that I'm aware of. The most recent one that I can remember is when I was pregnant with my first daughter. I had an extreme case of hyperemesis gravidarum. It's a very rare condition that happens in a very, very, very small amount of pregnancies. And the care that I received from the doctors and nurses at GMH was second to none. I was also hospitalized at 4 other hospitals for the same condition while I was pregnant, and none of the care at Inova Fairfax in Virginia, at Georgetown in Washington, D.C., at a hospital in Houston even compared to the care that I received at GMH. I don't think anybody here can dispute that the quality care that we receive at any of the hospitals here on Guam, that's not up for debate. And we're grateful for professionals in both hospitals that provide us the care that we need. But in terms of being at the right place at the right time, that's not a risk that I'm willing to place on our GovGuam employees and our retirees. And I think that there are concerns that I have with this bill, but I'm willing to try to offer up what I can and encourage my colleagues to help me in identifying issues of mutual concern and trying to address those. And in that spirit, Madam Speaker, I'd like to offer 2 amendments, 2 technical points for amendments, and if I could have them passed out. The first one, Madam Speaker, would be an amendment to page 1, line 9 of the bill. And this, in consultation with our legal counsel, we wanted to make sure that we are very clear about the effective date of enactment of this bill should it pass. And so my amendment would be to strike out the words, "This act shall become effective upon enactment," and replace it with the words, "This act shall take effect upon the expiration of the current contract period for Government of Guam group insurance pursuant to 4 GCA subsection 4301. And essentially, Madam Speaker, what this does is, in the current language of the bill, it dictates all companies or other legal entities providing or applying to provide health insurance or the provision of health care to the government of Guam shall have contracts, and then it goes on and on. But I want to just be very clear that instead of grouping it all into all companies, we want to make it the language a little bit tighter so that only the companies that this act would only take effect upon the expiration of the current contract period. So all of those participating after this current contract would be affected. And I thank my colleagues in advance for their support of this amendment to Dismasi.
Thank you, Senator Lee. I believe everyone has a copy of the proposed amendment. The amendment is on page 1, line 9, and it is to read, "This act shall take effect upon the expiration of the current contract period for Government of Guam Group Insurance pursuant to 4 GCA subsection 4301. Are there any senators who would like to speak on the amendment? Are there any senators that would like to speak on the amendment? Are there any senators that would like to speak on the amendment? Senator Paris?
Madam Speaker, just a point of inquiry. So what does this mean is that this bill, should it pass, does it mean that this bill would not take effect until for the 2020 or 2021 insurance period?
Does the sponsor yield to the point of inquiry?
I'll yield, Madam Speaker, and I thank my colleague for the question. So it would essentially allow that the bill take effect upon the expiration of the current contract period for GovGuam Group Insurance.
Senator Paris, does that answer your point of inquiry?
Thank you for your response. Just to further clarify, so this could be inserted into the current negotiations. Would this be the possibility of this bill being inserted into the current negotiations?
Senator Lee, do you yield?
So it's my understanding that it would impact the current negotiations, but it wouldn't take effect until the current contract expires.
Senator Paris, you're recognized.
Thank you, Madam Speaker. Yes, that clarifies it.
Is Senator Chilahi, you're recognized.
Thank you, Madam Speaker. Just an inquiry as to whether this language accounts for the rollover that we're currently under. I guess we're currently under, I know that they rolled over the prior contract, so I don't know if they call that the contract period. I don't know if that's, I'm just not sure. I guess I would like to ask the department. I have no objection to this, to the intent, and I guess I just want this to work for the Department of Administration, who has to enforce that contract. Thank you.
Okay. We'll take a quick recess and ask legal for their opinion. We'll recess until 2 p.m. today. Thank you.